Welcome to Healthy Living, your health awareness show on Afro Worldview, the show that keeps you informed with all your health-related matters. My name is Ronald Athegi, and today we focus on women's health. Let's check out what we have in store for you. We speak to obstetrician and gynecologist Dr. Ayanda Mbele, and we get fit with some exercise to kick off winter. Women have unique health issues such as pregnancy, menopause, breast cancer, osteoporosis, depression, and many more. Health issues that affect both men and women can affect women differently. We sat down with a gynecologist to find out what women could do to prevent such ailments. Doctor, thank you so much for making time in your busy diary to chat to us.
You're most welcome, Ronald. Thanks for coming today.
Doctor, the first question, and I think it's the most overarching question to dictate the tone of our chat today. Why is it important for women in particular to look after their health?
Women, they go through different phases in life. They are pre-pubertal, that is before menstruation, pubertal, when they start to see their menses, and the reproductive years, and the postmenopausal years. And then they go through different phases, and they go through different hormonal changes, and they face different challenges, and they also, during those periods, they face different risks.
So, I mean, that's very important to know because, you know, they have the reproductive organs that, you know, houses the baby that's developing and growing and ultimately, you know, helps give them a healthy baby at the end, hopefully. Yeah. So when you look at that, because we'll revisit the different phases of their lives, but when we look at the reproductive organs in particular, you know, it becomes a very, very, very big concern. And when you look at the general health of your reproductive system as a woman, what are the key things they should be aware of?
We tend to focus only on the uterus, the ovaries, and the female external genital organ. But also this includes the breast, that includes the hormone that affects other part of the body. Because the hormones that are produced, they have an impact on the skin, on the mood, they have an impact on the bones. So it is important to look at a female in totality, not just focusing only on the organs.
Wow, I mean, that's absolutely incredible because I love the context that you gave it right now. Is that although we can focus on there, especially in the obs and gynae industry, you know, it affects every other part of the body. Yes. Now, dealing with the hormones that we need to look at, what are the key hormones that are important, you know, when it comes to the woman health, and what role do they play in the body?
The key hormones are produced in the brain, in the pituitary gland, the follicle-stimulating hormone and the luteinizing hormone. You see, they are in the brain, but they have an impact where? On the ovaries, which are actually positioned lower down in the pelvis. So the follicle-stimulating hormone influences the development of the follicle in the pelvis. Then the development of the follicle, then the follicle develops and goes to ovulation, then potential conception. And then the other hormone is the luteinizing hormone, which is also produced in the brain, that has got an impact on stimulating ovulation in women who are in their reproductive age.
Wow.
So that there's that link. And then the ovaries in turn produce estrogens. Estrogens, they've got an impact, they've got an influence on your skin, your mood, the bones, the health of the heart. Yes.
Wow, and what about progesterone? Because that's also a name that gets bandied around when women go through, you know, their menstrual cycles. Like, no, my hormones are out of sync, my estrogen and progesterone are not, you know, on par.
Okay, so yeah, that's very important. Progesterone is a hormone which is produced after the 14th day of the menstrual cycle. It sort of stabilizes the inner layer of the uterus. And then it is produced after the woman has ovulated. So when the woman has ovulated, the progesterone levels start going high up. We tend to test that around about day 21. We use that to predict if the woman has ovulated or not. So it is an important hormone. What happens if the woman has not ovulated? They continue producing estrogen. As a result, they can develop things which are called functional cysts, a follicular cyst, which can actually grow and grow and grow. If there's no intervention, it can cause potential complications for a woman in the reproductive age.
Now, when we look at this, I mean, I'm glad you mentioned that, because something else that's ringing in my brain is the topic that many people don't understand and often gets misdiagnosed by the general practitioners, and that is endometriosis.
Yeah.
Because you speak about the ovaries and the cysts and, polycystic ovarian, cancer becomes a risk as well. But the endometriosis link, people just assume, and the women assume, I just have painful menstrual cycles. Are there any particular signs and symptoms they should be aware of, and what would be the treatment protocol thereof?
Endometriosis has got different pathophysiological causes. It's actually the presence of the endometrial tissue. Endometrial meaning inside the uterus. It's supposed to be inside the uterus. But now it's found outside the uterus, in the peritoneum, on the bladder, around the ovaries and the tubes, also on the bowel. So it may present with severe pain during menstruation, pain during intercourse. Some women who present late, they can actually present with infertility because of its impact on the fallopian tubes. It actually can lead to the blockage of fallopian tubes. I've seen women who develop endometriosis in the umbilicus, endometriosis in the lungs, so it can actually be quite an extensive disease.
So it's really about finding the right specialist and investigating it and seeing what can be done and identified.
Yeah, making the correct diagnosis and discussing with the patient on different treatment options. But the best way to diagnose endometriosis is actually the symptoms. Then once the symptoms are suggestive and the clinical examination is suggestive, it is advisable that women should have a laparoscopy to confirm the presence of endometriosis. Take a biopsy. If you cannot remove it, if you cannot excise it, because the best way of treating endometriosis actually is to remove it. There are different hormonal therapeutic modalities, but I mean, those are actually short-lived. They are actually short-lived. They are for short-term use.
But what about when you get cysts on the ovaries and issues with the fallopian tubes? Because the ovaries produce the eggs, it travels down the fallopian tubes into the uterus. If you identify those cysts, what are the signs and symptoms a woman should be aware of? Because that seems to be quite common.
Commonly, the women with an ovarian cyst will present with the irregular menstrual cycle. Irregular, they say, for this menstrual cycle on and off, that's an early sign. Later, they may present with lower abdominal pain. Lower abdominal pain can lead to infertility, because remember, for you to conceive, the ovary must be healthy for it to ovulate. So the main thing is actually lower abdominal pain and actually irregular menstrual cycle.
Wow, Doctor, there's so much we could chat about when it comes to this topic, but we'll chat to you a bit later in the show. We're going to explore the different phases from being a teenager into a young woman into an older lady that's going through menopause potentially, and look at the signs and symptoms and what can be done in those stages.
Yeah, we'll do.
Let's take a look at this week's health news.
In your health news, researchers have found that 27 years from now, almost a quarter of the global population will be obese, and warned of the mounting medical bill. In South Africa, 28.3% of adults are obese, and diabetes is ranked as the second biggest killer in the country, 2 spots ahead of HIV and AIDS. South African women across demographics are more likely to be obese and overweight in comparison to South African men. 1 in 8 people, up from 1 in 11, will have type 2 diabetes, a form of diabetes that generally hits in adulthood as a result of being overweight. Breast or bottle? There's no need to judge. Naturally, breastfeeding is best. However, breastfeeding doesn't always work out, and even pro-breastfeeding moms may find that they need to supplement with infant formula for some reason. So, if you're about to have a baby, it's worth knowing what to consider when feeding your baby. A group of pediatricians and geneticists warn that infant formula can cause acute liver failure in some babies. Babies with hereditary fructose intolerance, also known as HFI, face a risk of acute liver failure if they are fed infant formulas containing fructose. However, HFI-related problems do not appear in a baby who is being breastfed exclusively. According to a new study reported in the journal PLOS ONE, too much sitting may have an unhealthy effect on a part of the brain involved with memory. The study further found that too much time spent sitting was correlated with an unhealthy thinning of tissue in a key brain area tied to memory. And it appears that the link isn't simply due to the fact that people who sit for hours each day aren't exercising. There was something about the act of sitting itself that seemed to be key. Ever thought of tracking your menstrual cycle using an app? Fitbit has introduced a new feature that will help you keep track of your periods, fitness, and fertility at once. You can log on your monthly cycle, record the symptoms, hello cramps, and see that data alongside your fitness stats on your Fitbit. And FYI, it also gives you reminders about your fertility and reproductive health, so you'll be able to track your health trends over time, like how long your cycle usually is and when you usually ovulate.
Dr. Mbele shares more after the break. Stay tuned.